Today we are going to conduct a orientation training of National Deworming Day. One of the importance of this year is that during the past 2 years, due to the COVID pandemic, we have not conducted the National Deworming Day. This is mainly because the schools are closed and also there is a pandemic is severe in certain part of the state. But this year we are going to introduce again start the Deworming Day program, and we already sent a request for the Kerala Medical Officers, Kerala Medical Service Corporation for the purchase of albendazole. They already issued a work order to companies, and we are expecting the drugs this week. Previously, they said that it will be delivered by last week of July, but it was delayed. Most probably, we will get the drug in this week, and it will take around 3 days for the distribution to all schools as well as the primary health center. And inter-departmental coordination committee meeting is already conducted by our principal secretary with the line department like LHA, social welfare, and education departments. And over to you, Madam.
So let me upload my presentation. So today we will be now discussing on the steps which are being taken up for planning, implementation, and monitoring and review of the NDD program. So this is the background that our country, India, is endemic to stage. The STS, that is salt transmitted ailments. The prevalence varies. It ranges from 12% in some states to even 83%. That's very high prevalence in some of the states. So we have Rajasthan and Madhya Pradesh who are at the lower end of the stage prevalence, like 12% around. But some of the states are having very high stage prevalence. So this is as per the survey, which was conducted by National Center for Disease Control, and the NCDC was engaged by the Child Health Division of the Ministry of Health and Family Welfare for conducting the STS prevalence survey. So as you must be aware that this NDD program was launched in 2015. On that year, 11 states and UTs could conduct this the first round of NDD, and then the next that was only one round in that year. And after that, from 2016 onwards, the states except Rajasthan, which have very low STH prevalence, all other states and UTs are conducting STH this NDD, that is a National Deworming Day program, twice in a year. And in Madhya Pradesh and Rajasthan, it is conducted once in a year because of the low prevalence. So after the COVID pandemic came, many of the states they actually failed to conduct this NDD because of the pandemic situation. And so Kerala, as Dr. Sab has said, that Kerala could not conduct the NDD rounds for the last 2 years. So till date, around six rounds have been conducted further from the report. So we are committed to control the STH infections, and for this we need to have a coverage of at least 75% in each of the rounds. And the children of 1 to 19 years, they are being covered, and we target that all the children of 1 to 19 years, as per the census population, they should be administered albendazole, and this is as per the WHO guidance. So STH in Kerala in November, December, NCDC conducted the STH prevalence survey, and the baseline prevalence was 45%. So when the prevalence is more than 40%, we consider it as a severe public health problem from the point of view of STH prevalence. So Kerala was in the severe category, and then Kerala conducted 6 rounds of NDD, and the follow-up survey was completed in September 2019, and the prevalence declined to 32.5%. So there was a good decline in prevalence. So among all the states and UTs, 14 states could demonstrate a significant decline in prevalence levels. So, but as the Kerala could not conduct the NDD round for the last 2 to 3 years. So now we are not in a position to understand what is the current prevalence level in Kerala. So NCDC has again started conducting this follow-up prevalence survey. So and especially for Kerala, the NDD rounds could not be conducted for the last 2-3 years. Now there is we think that Kerala is one of the priority states where this prevalence follow-up prevalence survey should be conducted. So you are all aware why many of the states could not conduct NDD during this pandemic, because we use the schools and the Anganwadi center platforms for implementing this program, and many of the states, most of the states actually, have the schools and Anganwadi centers closed due to this pandemic. In some of the states, they actually adopted this door-to-door approach for administering this albendazole tablet, taking the opportunity of the COVID visits which were conducted by the frontline workers. Many of the states, they have been able to undertake this NDD implementation, but in Kerala, what we understand that this program could not be conducted. So here you can see, as per the initial state prevalence survey, which was conducted in 2016, 15-16. So the states have been divided into 3 categories depending upon the prevalence. So the states with higher prevalence, it's actually you can see many of the states have more than 2% prevalence for the initial survey. 14 states actually, they are higher in that category, that is with the states with high prevalence, and 12.31 crore. Actually, this school children and preschool children, they are coming under this category. For the moderate prevalence states and UPs, there are 20 states and UPs. So Kerala is one of them. And so, and here in these states and UPs, 15.71 crore children of 1 to 19 years, they are endangered, and they are actually the program has to be implemented for these children of 15.71 crore. And the Madhya Pradesh, as I already mentioned, that Madhya Pradesh and Rajasthan, they have low prevalence, that less than 20%, and so there the population is 6.19 crore. So a total of 34.2 crore children of 1 to 19 years are targeted in every round to be covered by through this NDD program. I think you have, as most of you are aware of the perspectives. What is the objective? So objective is to administer Deworming tablet to all the children of 1 to 19 years, and using the schools and the Anganwadi center platform. And this is for achieving an improved child health and nutritional status, and which indirectly actually affects the access to education and quality of life. So the stakeholders, there are in this program, this is a unique program that multiple stakeholders that have been involved, including different ministries for implementation of the program. And so a very coordinated action is required for implementation of this NDD program. Along with Department of Health and Family Welfare, of Education, Department of Urban Development, Department of Women and Child Development, Department of Drinking Water and Sanitation, Department of Panchayati Raj, Department of Human Resource Development, and along with them, all the partner agencies, that is the development partners who are working in the states, they need to support this program implementation in the states. So it's a very coordinated activity which is required for NDD implementation. So what is the purpose? So how does this NDD program work? So as you are aware, so worm infestations, they result from poor sanitation and hygiene conditions, and worms are transmitted through contact with contaminated soil. So the cycle. It's a cycle that when an infected individual, they passes the feces. So feces contain the worm eggs, and if by chance there is this contaminated eggs and feces get contaminated with the soil and water, so they actually are transmitted into soil and water, and there the eggs develop. The eggs develop mainly in the soil, and then the individuals who are infected by the eggs, which are ingested from through food or through dirty hands, or in case of hookworm larva, this larva can penetrate the bare skin if the in one goes to barefooted, so the farmers usually they get these infections, and those children who are walking barefoot in the infected fields, they can get this infection through penetration of the skin by the larvae. But on the other infestations like the the roundworm and the threadworm, they usually gets infected. The people get infected from them through ingestion of the eggs, and so the eggs are actually ingested when the raw vegetables are like in salads. These are prepared without the proper care, that is proper washing, and without any doing in hygienic condition. So those can actually, those are the sources where from the infections can go into the body of the. So the severe infections, as you can understand, that this cause a range of symptoms, which include diarrhea, abdominal pain, weakness, loss of appetite, even anemia, because hookworm infestation actually causes a severe anemia also. So so that's why this is the purpose of the program, because this NDD program was started as an additional effort to reduce malnutrition, to improve the health and nutrition status by getting the children dewormed, because the children actually they are usually they are susceptible to get these infections through different channels, as I've already said. These are the actually the histology and histopathology. You can say here in this slide I put this so that this can be used by you at the district level for educating your the people where the beneficiaries who are with whom you are interacting, as well as to educate the healthcare providers at the frontline level. So you are all aware, as you are, I think most of you are doctors, and even the paramedical staff also, they understand that these worms, they feed on the host tissues, and they including blood, and it leads to anemia. And the worms also this consume nutrients meant for the human body. So this when the eggs they hatch in the intestine, and then the larvae and then the adult ones, they actually feed on the nutrients which we consume through our food. So that's why there is a lack of nutrition, which is actually the body cannot absorb the nutrients, because this the worm they absorb these nutrients, and so there is poor nutrition, and ultimately it is causing stunted growth, underweight the status. And then the roundworm may also compete for the vitamin A in the intestine. So they are, in spite of taking adequate food adequate in vitamin A, the child or the person can have the deficient vitamin A level, because this worm they take up this vitamin A from intestine. So in severe worm infestation, the children are often too sick and they are tired to concentrate at the school, and or they may even fail to attend the school, and which negatively impact the child's physical and the cognitive development. So NDD, we administer and then the result tablet, that is the program which we can see, but not it is not the sole purpose. The purpose is also to educate the population, the beneficiaries, about the other ways to prevent worm infection. So what are those very simple things, but it's important, like washing hands, particularly before eating and after using toilets, using sanitary latrines, wearing slippers and shoes, especially when moving in soil, drinking safe and clean water, eating properly food, washing vegetables, fruits in safe and clean water before consumption, and keeping nails short and clean. So these are the 7 or 8 points, which are very important. That is to maintain personal hygiene, to maintain food hygiene, and to be aware of the sources where from the infections can come into the person's body. So, and the treatment is deworming graft. We actually provide albendazole. This is a prophylaxis. But if the person, your child is suspected to have worm infestation, like there is history of one passing of worm, in that case, it has to this worm infestation has to be treated through deworming. That's also. And but here in the program, we are using the prophylaxis dose, that is for 1 to 2 years of children. This is a half tablet. That is one tablet of albendazole contains 400 milligrams. So we give half tablet to the children who are 1 to 2 years old, and for 2 to 19 years, it's a full tablet, that is 400 milligrams. So as I have already said, schools and Anganwadi centers, these are the platforms which are used to deliver this deworming drug. And why we have chosen these platforms? Because there is the opportunity to get the large number of children, as most of the children are going to the schools, and also the under 5 children who are small enough, they are going to the Anganwadis. So there and at a time we can get many children, so that this program can be covered effectively. And this enables the program to reach high coverage in a single day. So we have taken the strategy of single day, that is so that maximum children they can be gathered in the Naval Center, or they can be reached at the schools, and so they can be their availability in the school. They give the opportunity to cover to have maximum coverage, and also if some of the children are being missed in during that NDD, that is the deworming day, those children have to be they can be covered in other next. So I am actually explaining all these things why these are the reasons why schools and centers have been chosen, because the teachers, they are and the Anganwadi workers, they are the invaluable resource. So because they are the people in a community. In any community, teachers are well known. Similarly, the Anganwadi workers are also well known. So these teachers and Anganwadi workers, they can pass the knowledge about prevention and treatment of the worm infections, and they can. Now I am going to going to the steps of planning. So planning, I think as Dr. Saab has said, that you have procured the drug. So that means you have already started the planning process. So the planning and interdepartmental coordination meetings and stakeholder meetings, these are all important. As I have already said, so many multiple departments actually get involved in NDD program. So a proper prior planning for these meetings, coordination meetings, that is most important, so that every one of all of these stakeholders, they get sensitized, and everyone is on the same board. And then target setting. This is another very important criteria for planning, because we always, as I have initially I have said, that 75% of the census population, that is census population for 1 to 19 years old children, should be targeted. So that is the we say that it is at least 75%. It should be more as high as possible, so to get better results for get a decline in the stage prevalence. Target setting, sometimes we see that the state they go for a lower target, and then they show their achievement at 90% or 95%. But actually, when we compare that with the final achievement of the state census population, then many times we see that it is less than 75%. So in that case, in spite of the best efforts, the state is not being able to achieve the optimum coverage. So that's why we request you and this time also. So please target according to your census population, and try to achieve as much as possible for your coverage. So as schools and Anganwadi centers, they are open now. They are open across the states. So this round, the first round could not be conducted by the state. Let's see, this round we expect that there will be a very good coverage using this school and Anganwadi center platform, and also adhering to the COVID-19 protocol. So you are all aware, these are all known to you, but I am just repeating because I think that after 2 years there may be there is a need for a fresh look into the program. So the teachers, we expect the teachers to administer the albendazole to all the school children, and Anganwadi workers will be administering albendazole to all the children of 1 to 5 years, and all the out of school children and adolescents. So I will be speaking about how they have to be addressed. So now the non-enrolled children, they have to be mobilized to the nearest Anganwadi center for deworming through the support of ASHA. So we provide incentive to the ASHA for making the line listing, and because they already have the line list of the under 5 children with them. So it's not a difficult thing for the ASHA to prepare the line list of 1 to 5 years children, that is, except the 0 to 1 year age group. For 1 to 5 year group, the ASHA has to prepare the line list, and then that line list has to be, the ASHA has to mobilize those children to the Anganwadi centers. And also, ASHA also has the list of the out of school adolescent girls. So the out of school children and adolescent girls, they should also be mobilized by the ASHA, and so to fulfill the criteria of getting this incentive. And then children, and one thing we have to remember, that children who are sick and or if they are under any medication, so they will not, they on the day of NDD or mop-up day, they will not be given the drug. These children should be advised to take albendazole tablet upon recovery if they are sick. And children who could not be dewormed on deworming day, as I have said, that due to absenteeism or due to illness, they must be administered the drug on the mop-up day if on that day they are found to be not sick. Then another important area is drug procurement, timely availability of adequate quantities of albendazole tablets as per the target, and to ensure the quality testing of the procured albendazole tablets prior to their distribution. And so we expect that sufficient quantity of albendazole tablets must be reaching to every center, that is in all the Anganwadi centers and the schools beforehand to implement the program in an effective manner. So here regarding the schools, I have a request that I would also like to understand from the state what is the status of motivating the private schools, because in Kerala there are many private schools compared to other states, and if the children of private schools, they are left out, they are not being provided albendazole. So in that case, the ultimate target of covering 75% of the census population will not be achieved. And finally, the decline in ST prevalence is also not achievable. So I think the state has to work on in this area, because earlier when when we used to have physical meetings at the national level, so the representative from the Kerala always highlighted this issue, that there is a challenge in covering this in the private schools. So and there is the challenge, actually it enhances the more challenges, because we have also been reported that the parents of the children of the government schools, they sometimes raise objection that why this albendazole tablet is not being provided by the state to the private school. So in that case, why their children should get this albendazole tablet? So some queries are also being raised by the parents. So I think actually we advise at that point of time also to develop special IEC DCC material, and to have very strong campaign of why this albendazole administration is important for all the children, including the children of private school. If they are affluent also, they should also get this albendazole tablet twice in a year. So community awareness and mobilization. So that is the most important activity for having a successful implementation of the program. So intensive awareness generation as per the local requirements, as I was saying, and as per the local context, that has to be focused. So there is need to inform the community about the benefits of deworming, about the dates of the deworming also, and to share the messages of the at the school management committees. So I think we suggest that in every district, the district health authority should specifically engage with the school management authorities beforehand to sensitize them about the need for this program implementation. And in many some we have seen earlier also that some of the states, they in their districts, they arrange they actually sit with the school management authority, and they involve them for arranging a parent teachers meeting before the NDT program, so that in those parent teachers meeting, each and every parent, whenever they are discussing about the child's performance, the parents are also sensitized of the impending the coming up with the impending NDT program, that is which is usually planned in that way, that after the parent teachers 7 days or 10 days after the parent teachers meeting, that NDD date is fixed. So all the parents are sensitized, so that they don't they fail to send their kids to the children to the schools. So that's I will request the state to take special care in this aspect. And similarly, the Gram Panchayats and the BHSNC meetings, which are the meetings are being held before the this NDD in National Deworming Day. Those meetings should be targeted for the sensitization of the Gram Panchayat members and the BHSNC members about the importance of implementing this NDD program, so that they also take an active role in mobilizing these children to the schools and Anganwadi centers on the day of NDD. So I especially I hope that in Kerala will be doing this in a very good manner, because I went to CRN in maybe around 5 years like that, and then I saw at that point of time that all the village panchayats, they are so active. They are so actively coordinating with the health of the department for implementation of the different health programs. So it was really heartening to see that thing which we usually don't see in other states. So I request the state fervently that the Gram Panchayats should be involved for implementation of the NDD program. And so to motivate the parents to bring their children to the Anganwadi center and send the children to the schools. Then the TV, that is television, radio, platforms like WhatsApp, Facebook, Twitter, everything. It should be a multi-pronged strategy to increase the reach of the messaging, and to use the social media handle of CMs, the chief ministers and the health ministers. So whatever means you have in your hand, please use them to multiply this effect of message of transmitting these messages. Now, the third point is the training and capacity building. So, training to the teachers and the about their roles, administration of the tablet, and management of the adverse events. So, these are three important areas. Number one, whether the tablets are reached in time. If they have not received in time, so the timelines are being fixed during the coordination committee meetings, which are held at the district level. So the albendazole tablet should be administered by the teachers and the Anganwadi center. It should not be given in the hands of the children to take by themselves. But so it should be paid by the teacher, and there must be the arrangement for drinking water in the classes, so that after swallowing, and actually it should not be swallowed, it should be chewed by the child. The children 2 to 19 years of age, they are being able to chew. So they must chew the tablet. They should be asked to chew the tablets, and then some amount of water can be given to them if they require for drinking. So and the children who are below 1 year, 2 years, that is between 1 they should be given half tablet of albendazole tablet, and tablet should be crushed well between the two spoons, as in the training we show how to crush the tablet between the two spoons. So it should be crushed well, and then it should be given slowly to these young children of 1 to 2 years, because some adverse incidents have happened like the choking has happened due to at the time all the content of the tablet is being pushed to the mouth of the baby. So it should not be like that. Uh, so this training should be done in a proper way, so that there no adverse event happens. Everyone should also be aware of the adverse events. What can happen if there is any adverse event, how to manage them. So all these are laid down in our national guidelines. I hope the older guidelines, this is not the newer one during the COVID. The older guidelines are there with you all. If you are not having, please tell us and we will share with you again the soft copy. So this training is so important for the teachers and the Anganwadi workers, so that this so that there is no hazard created during administration of the tablets. And so and also the parents of the children during the parent teachers meeting, they should be informed about the mild side effects which can happen, like the nausea, like dizziness, like so because those children who are having a very high worm load, they can have some mild side effects. Also, and the adverse event management protocol, I think it should be followed strictly. All the arrangements should be made regarding the who will be managing what, because we say usually the states which is being done, that the teams are made alert and they with the vehicle, and even the ANMs and the Anganwadi workers, and and the school teachers, they are the Anganwadi workers and school teachers, they are provided the numbers of the medical officers of the primary health center, local primary health centers, and the ANMs. And if any adverse event happens, immediately so that they can be contacted and immediate actions can be taken up. But there is usually, if the administration is done in a careful manner and in a proper manner, and the Anganwadi centers and teachers are trained, in that case, usually there is no happening of the adverse events. And so the parents' confidence should be built that when the child complains of any sickness after consuming the tablet, so the child should be kept under observation, and so there should be care that if they show any serious side effects, they should be immediately transferred to the hospital. And the partners, the development partners who are actually engaged in your states, please engage them to facilitate these planning meetings, as well as the overview, the implementation, the training of the Anganwadi workers and the teachers, and and also they may be involved in customization of the IC and training materials as per the local need. So, age-specific goals, I have already said. When training, it has to be very emphatically told to everyone, and it should be, as I have said, it should be administered properly. They must chew the tablets properly, and the other children, it is crushed. This slide I have already said about these points, and phone numbers of the nearest PSC, medical officer, block PSC, ANM, for adverse event management support. So, and we also advise that this phone number should be stuck on the entrance wall or the door of the schools or the classrooms, and also in the Anganwadi centers. And never administer a medicine to a sick child, and do not instruct children to swallow the medicine without chewing first. If the tablet is swallowed without chewing, then this tablet will not have any action for the deworming effect in the intestine, because this tablet, when it is chewed, it forms a layer on the wall of the inner wall of the intestine, and that layer of that medicine, that the albendazole powder, that works on the intestinal worms. So if the tablet is chewed, this effect will not be obtained. So again, we have a specific slide on the adverse event management. So the emergency helpline numbers, these numbers should also be given to the schools and Anganwadi centers. And clean water and ORS, this, and along with the glasses, for preparing this ORS must be ready. They should be made available, because if any child vomits, in that case, though these are rare chances, but if the arrangement should be made so that there is immediate actions can be taken to give some ORS to if there is vomiting. Then reporting. So reporting of the NDD, the second round, it should be done through the reporting format, which I hope you already have, because this is in line with the rounds prior to the COVID-19 pandemic. So it's the reporting format is also there in the national guidelines. And so and another thing, so because many states, they have actually leveraged the existing MDN, that is midday meal, that is PM Poshan, for real-time access to NDD coverage, because they actually there is a portal where they upload the performance for the MDM, midday meal or PM Poshan. So, and they also upload the IFA supplementation. So during this NDD round, this platform can be leveraged for this NDD. Their portal can be leveraged for NDD coverage, getting information on NDD coverage also. And the teachers and Anganwadi workers, they have to record the administration in the class attendance registers and the enrollment registers in the Anganwadi centers. So as per our guidelines, there should be the teacher or the Anganwadi workers should give a single tick for the drug when the drug is being administered on the NDD, that is the National Deworming Day. And if the child is missed on that day, so and the child is being covered on the mop-up day, in that case there will be double tick for for that child who is being provided this tablet on the mop-up day. So in that way, the reporting will also become easy. That how many children have been covered on the NDD and National Deworming Day, and how many have been covered on the mop-up day. You can immediately get separate data through single tick and double tick. And the role of the partners and the line departments in reporting, they should be actually they should also in addition to the monitoring, they should also provide support for implementation and this brainstorming of how to maximize the coverage. That can be done through the involving the partner agencies. This is the NDD reporting format. So it's a simple format. So now name of the health unit, districts, which block or municipality or corporation, and then number of government and government schools, number of the private schools, the number of government schools targeted actually reporting coverage, and number of private schools who are reporting coverage, and then number of Anganwadi centers and how many out of them how many are reporting coverage. Then number of ashas oriented. So I should not read all these points. So this is they are clearly written, and this as it is done for other reporting mechanisms for other programs. Here also all the baseline data are being captured through this reporting format. So like total children out of school, total children registered in the Anganwadis, and total children registered in the Anganwadis and who have been covered in this way. So this reporting format can help the ASHAs also to prepare their line listing for the under 5 children, and for the who are registered in the Anganwadis, who are not registered in the Anganwadis, and also those out of school children and adolescents who are registered as well as not registered in the Anganwadis. So separately under the different heads, these have to be these data